To disclose or not to disclose mental health issues in the workplace is a sensitive dilemma. On the one hand, disclosure of mental health issues may hinder an individual's employability because of social stigma and discrimination. On the other hand, workers can be treated more positively due to the disclosure of mental illness, such as receiving support from the supervisors. Whether or not a disclosure of mental health issues in the workplace yields positive outcomes for employees or job candidates relies on many factors. To explore the advantages and disadvantages of mental health disclosure from different stakeholders' perspectives and factors that determine a successful outcome of mental health disclosure for employees, Browers and his colleagues have conducted a focus group study through interviewing people of different groups. The study used a purposive sampling method to recruit participants. There were 27 people participating in the study that represented 5 focus groups of stakeholders, including 6 people with mental illness, 5 employers, 4 human resource managers, 4 mental health advocates, and 8 work reintegration professionals, such as occupational physicians and occupational social worker. Each interview lasted 2 hours and they took place in a conference room in the university, conducted by 4 researchers. All the discussions were audio taped and transcribed for thematic content analysis. Each transcript was repeatedly read and coded by 2 researchers independently to enhance reliability. The researchers created themes and subthemes within the predefined categories through constant comparative method. Four themes were identified as positive outcomes of disclosure and 2 as negative outcomes. First, disclosure improves understanding of the discloser's behavior and situation, and such can improve their relationships at work. Second, disclosure will be allowed to be who they are. The authenticity is important for their well-being at work. Third, disclosure leads to support from the work environment, such as providing work adjustments and understanding for workers with mental illness. Lastly, disclosure can help create a friendly and inclusive workplace culture, which has effect on reducing stigma in the workplace. Disclosure also leads to negative outcomes, such as discrimination, as the disclosure tends to be seen as financial risk for the employer and thus be avoided for hire. Disclosure can lead to stigma, creating social distance or yield disrespect from others at work. For factors that influence the outcomes of disclosure, first main theme identified is the disclosure process. Factors including to whom to disclose, the timing of disclosure, preparation of the disclosure process, the content of the disclosure message, and the discloser's communication style. The second main theme is workplace factors. The level of responsibility of the worker. More negative outcomes of disclosure were expected in high responsibility jobs. Financial factors is another determinant. It was believed that in a poor economy, chances to be hired strongly diminish after disclosure. Lastly, employee factors, the type of mental health issues or diagnosis. Autism, ADHD, and burnout would yield more positive reactions after disclosure than schizophrenia, bipolar disorder, or substance use disorder. To sum it up, all stakeholders were in favor of disclosure, but for different reasons. The disclosure outcome is associated with many factors, most of which that determine positive outcomes cannot be influenced by the individual. However, this study found factors that can be influenced by the individuals with mental illness. Thank you all for listening. Now it's time to throw your questions.